Welcome back to Skin Reform, a podcast dedicated to all things skin and dermatology. I'm your host Alex, and I'm joined by our resident skincare expert, Dr Naomi Mackle. In this week's podcast, we're going to take a deep dive into the world of pigmentation. Pigmentation is a really common skin concern that a lot of you probably are familiar with, but do you actually know what it is? So, Dr Naomi, what is pigmentation?
So pigmentation refers to the colour of the hair, eyes and skin. It's determined by the amount of melanin in your skin. So really it's determined by genetics. But certain things like sun exposure, geographical location, certain drugs, hormones, inflammatory skin conditions can all contribute to it.
And when it comes to pigmentation, we have hyperpigmentation and hypopigmentation. So what is hyperpigmentation?
So hypopigmentation is darker patches on the skin. Again, it's determined by genetics. Darker skin patients suffer more from hyperpigmentation, but again, sun exposure can cause it, geographical location, inflammatory skin conditions like eczema, psoriasis, acne. These can all cause post-inflammatory hyperpigmentation, certain drugs, hormones.
There's likes of that. And then hypopigmentation, probably not as common, but again, what would cause hypopigmentation and how does it present itself?
So hypopigmentation is white patches on the skin. It's not as common as hyperpigmentation, but we see a lot of it. The most common medical condition would be vitiligo. We also see a lot of fungal infections, pityriasis versicolor, pityriasis alba. And also we see a lot of lighter skin type 1 to 3, who maybe live in Spain or Italy and they get chronic sun exposure and they get confetti-like hypopigmentation or little white patches on their arms. And that's really the skin is starting to fail.
I've actually seen that myself on certain people. So there are areas where the pigment has essentially died.
Yes.
Okay, brilliant. And when it comes to hyperpigmentation, the more common form of pigmentation, is it treatable with using just skincare at all?
It depends on the type of hyperpigmentation. If it's sun-related or age-related, you can improve a lot with skincare. Obviously, if you want outstanding results, you may have to go to the clinic and do lasers or peels or something similar. But medical conditions like melasma are much more difficult to treat.
And with hyperpigmentation, I suppose there's 3 main steps. You firstly want to block the overproduction of the melanin in the skin. You want to protect the skin with a sunscreen and maybe exfoliate off the pigmented skin cells. So in your opinion, what are the best ingredients to use to help with blocking that overproduction of melanin, which leads to hyperpigmentation?
So the most important thing is to wear a daily sunscreen, and we would use look for a broad spectrum SPF 50 plus that has a physical block and a chemical block. So you're getting a double block. In conditions like melasma, you also would like to block the visible light with something like iron oxide. You also need products with niacinamide in hyperpigmentation. Niacinamide will prevent the transfer of the melanin from the melanosome to the melanocyte. You mentioned tyrosinase inhibitors. Tyrosinase is an enzyme that directly forms melanin. So if you can block that pathway, you're reducing the amount of melanin produced. So that would be vitamin C, 20%, vitamin C and D, kojic acid, alpha-arbutin, hydroquinone. You also might consider something like retinol or retinoic acid, which increases the cell turnover. So obviously your damaged pigmented cells, if they're constantly being turned over, the skin looks a lot better. Moisturizers are very important as well to keep the skin barrier in good condition. But the moisturizer you choose, for example, it's acne and it's post-inflammatory hyperpigmentation, you must use an oil-free moisturizer. If the condition is eczema or psoriasis, you might need a urea base with lactic acid, which is very good for hydrating the skin and also will facilitate the penetration of other active ingredients. So it just depends on a lot of things. You mentioned exfoliants.
Yeah.
So we would always recommend a glycolic acid foaming cleanser to remove the pigment. We also do a home peel that has glycolic and mandelic acid in it. So it's quite a gentle peel, but it's extremely effective, especially with the aging skin. And I think that's probably it.
So really, I suppose the message is prevention is a lot easier than cure. So
Absolutely.
get your sunscreen on to help prevent having to go down the route of your tyrosinase inhibitors and all these exfoliants to try and get the skin.
Well, it's maybe not as simple as that. Once you go over 30 years of age, your skin starts to fail. And obviously then if you've lived in Israel or the Bahamas, these sunny countries, you have aged a lot faster than your peers. So I would have thought when somebody gets into the late 20s, 30 age group, they need to start adding in a vitamin C 20% serum alongside a sunscreen. And the reason for that is vitamin C is an antioxidant. So it's not just the UVA and the UVB. The skin is being hit every day with free radicals and pollution. And vitamin C will absorb this and enable the skin to repair itself. And then obviously if you're not pregnant or breastfeeding, again, once you go to the late 20s, 30s, you might start introducing a daily retinol at night to increase the cell turnover. So you don't need the same skincare routine in your teens as you do maybe in your late 20s, 30s. And then when you go into the 40s and 50s, menopause can start kicking in. The skin can become very dry. You have to actively restore the skin barrier. So it just depends what age you are and what you're complaining of.
And I just say if somebody has hyperpigmentation, they're using all the correct skincare as we just spoke about, what kind of time frame are they looking at to get the skin to a stage where the hyperpigmentation is no longer visible?
So in a very young person with fabulous skin, the cell turnover might be 30 to 45 days. But the older you get, the slower the cell turnover. And the face will respond a lot quicker than the body. So I would think anything from 3 to 6 months. But the most important thing is if skincare isn't working, it's time to see the doctor or the dermatologist. And if you go in and see the doctor or the dermatologist, you know, they'll take photos, you know, they see is it aging, they know if it's melasma, so they'll know the type of pigmentation. They'll make sure you don't have a melanoma, you know, and that's important too. Yeah. But it's they know the type of pigmentation. They might use a wood lamp to assess the depth of the pigmentation. They'll recommend a skincare regime that really is for your skin and will work, instead of wasting money on all these products that, you know, mightn't be suitable for your skin. We sometimes with, you know, we mentioned melasma. Melasma is different. You also need skincare, but you might need oral tranexamic acid to inhibit the inflammatory pathways. So it's sometimes you should start with the professional consultation. And then if you want to go further, you know, if you want professional treatments like chemical peels, lasers, there's really good stuff out there, but it has to be safe and it has to be suitable for your skin.
And you mentioned there professional treatments. In your clinic and based on your experience, what would you think is the most effective professional treatment to do in clinic to help with hyperpigmentation?
So it depends on the type of hyperpigmentation. If it's age-related and dyspigmentation or freckling, a fractional CO2 laser can give absolutely outstanding results. That would probably be our best treatment, but it's not our most popular because you need 10 days off work. There's a recovery time. So a lot of patients aren't that keen, you know, unless they're retired. We do a lot of secret radiofrequency combined with a medium depth peel like TCA. You know, for the younger patients, we do medical microneedling, we do glycolic acid peels, we do a lot of lasers. So it depends on what risk you'll accept, what money you want to pay, what downtime you'll accept.
Very important.
Exactly. And remember, if you're kind of late 40s, 50s, you may need the deep resurfacing. Whereas a teenager, if they've a little bit of acne scarring, medical microneedling is probably as far as you'd go or as far as you'd need to go.
Is enough to get it gone. And I think that really covers everything with hyperpigmentation in terms of the skincare and the professional treatments available. And I suppose the message is that help is at hand if someone is feeling at a loose end with their hyperpigmentation. When it comes to hypopigmentation then, Is skincare something that can help with that, or did you have to go down the medical route?
So with hypopigmentation, we would see a lot of vitiligo, which is white patches of almost depigmentation. And with the skincare, the most important thing is if you've a white patch with no melanin, you've no melanin to protect you against skin cancer. So we insist on SPF 50 plus broad spectrum sunscreen, not only to protect the patient from future skin cancer, but also you lessen the contrast between the normal pigmented skin and the depigmented skin, so it's not as visible. Vitamin C serum would also be very useful on the face. Medically, depending on what the cause is, we do use topical steroids, we do use Protopic. We sometimes get fantastic results, but skincare is important in hypopigmentation, but it's a different type of skincare that we'd recommend.
Okay. So I suppose the message to anyone listening is if they have hyper or hypopigmentation, help is at hand, but reach out to a professional and get the right advice on exactly what to use.
Absolutely.
And I think we spoke about this before, but can certain treatments or certain skincare cause either of these issues or even make them worse?
Well, hyperpigmentation, you would have, antibiotics that are prescribed for acne, the tetracycline antibiotics. They can cause hyperpigmentation, particularly minocycline. And this is quite serious if a patient is left on minocycline for a long time. So just to be careful. Some chemotherapy drugs, we prescribe a lot of isotretinoin for a severe acne. This can cause enormous hypersensitivity. So if you don't use a proper SPF 50 sunscreen, you might get hyperpigmentation. So yes, certain drugs. I'm not aware of the drugs that cause hypopigmentation apart from hydroquinone. That's a prescription-only drug in this part of the world, but that can be toxic to melanocytes and permanently destroy them. So I suppose with any drugs, or some patients buy chemical peels from the internet and might use them in darker skin types. That can be extremely dangerous and can cause permanent hypopigmentation or severe hypopigmentation that's very difficult to control.
And you've probably seen this firsthand throughout the years in the clinic yourself. Okay, no, I think that's all been very, very interesting and hopefully very helpful to people who are listening. I'm going to do a quick fire round with you just on some quick questions on pigmentation and what your opinion on is, which is potentially the best. So I suppose first off, the best ingredient for hyperpigmentation, we have kojic acid versus vitamin C.
Vitamin C.
Vitamin C, always. Okay. The best acid to use for exfoliating off hyperpigmentation?
Glycolic acid foaming cleanser.
Brilliant. What is the most common concern, do you think, that causes hyperpigmentation? The most common reason that causes hyperpigmentation?
It's probably acne and post-inflammatory hyperpigmentation from recurrent chronic acne vulgaris.
Very good. Can clothing help to prevent hyperpigmentation?
Well, yes, from a physical block, but you with clothing, you wouldn't recommend tight clothing because tight clothing that rubs can actually just cause hyperpigmentation from the rubbing or the friction.
Okay, very good. Can hyperpigmentation go away naturally?
Yes, but it can take a very long time. The most important thing to remember is what's the cause of the hyperpigmentation. So if it's eczema, if it's psoriasis, if it's acne, we must get the inflammatory condition under control as well as the hyperpigmentation, because there's no point treating the hyperpigmentation if you're not treating the cause.
And last question, is anyone exempt from hyperpigmentation?
I don't think so, but darker skin types have a lot more trouble with pigmentation than lighter skin types.
Okay, brilliant. Well, look, that has been our conversation on pigmentation. It's one of these concerns that can be quite disheartening to people, but I hope you've learned from our conversation that there is some help out there. So we hope you enjoyed this conversation and we hope you tune back in next week. Thank you for listening.